Welcome to the AAFE Training Center. We have got Sarah here as our patient today. So we're just coming in a little closer. We just want to do a quick interview with Sarah. We've been talking to her a little bit about what she's had. But she has had headaches for how long?
Years, since middle school.
Okay, so really a long time, and she has been through the ringer. We talked about you were on Topamax, right?
Yes.
And she's trying to wean herself off of that because that's not always. It did help her a lot, right?
It did.
But it has kind of side effects that makes people kind of goofy and moody and that kind of thing there as well. So she's had a lot of different things, a lot of things suggested to her. One thing she has never had though is
Botox.
Right. So we are going to try Botox because, and we started to do a little bit of a trigger point exam. We'll come back to that and address that another time. But for right now, what we want to do is just go ahead and give her some Botox treatment. And this is what we call aesthetic headache treatment of Botox, which is one of the AAFE protocols. And we are going to treat her and get rid of some of the muscle action that causes headaches and migraines most often. So we're going to go ahead and do that. She's got very strong masseters, very strong temporalis. So we're going to go ahead and give her this basic treatment to get started, see how she reacts from that. And then if we see that that's helped her some, then we are going to go ahead and address her trigger points as well. And in addition, we have got some treatment going on here for her acne scars, which we are going to do with solid filler smooth PDO threads from a new bio here. So Megan, take it away. I'll talk through this there just a little bit for this. But what Megan is doing now is she's using a Comfortox syringe filled with, which botulinum toxin are we using today?
This is Botox.
Okay, so we are using Botox for her aesthetic headache treatment here. And as you can go ahead and see, she is delivering it quite nicely. Sarah, you're a fantastic patient.
Oh, thank you.
Right, and we haven't even gotten to the Comfortox vibe yet for this. But at this point, we're just going to go ahead and use that for the PDO threads when we go ahead and get to that for that. Now, everything Megan is doing is going to be very, very technique specific, the way she's holding these muscles, the way that she is delivering these things. Faster is always better once you're in the muscle and you've identified the muscle for all of this. And this is going by itself. Just these injections for the glabellar area and for the frontalis are going to help because she does have some of the radiating headaches up in here. It starts in the back of her head for that. Turn her this way so everybody can go ahead and see. Sorry, let's go. You want to do the temporalis on this side there too?
Yep.
Okay. You can do this. You're doing fantastic, Sarah. Are you? How? I'm at least. I think you are. How are you doing?
Dude, great. It doesn't feel bad at all.
Well, you've had much more complicated procedures when it comes to this. Now let's turn her this way. Turn her this way just a little bit. 2 more injections. Megan, you're fast. And that's the point. This Botox treatment does not take very long if you know the anatomy, if you're very well trained to go ahead and deliver this, and you're using the right instruments like the Comfortox syringes here. Done. You are all done. How was that for?
Not bad at all. I don't know why my eyes watering.
I know.
Right? That's okay.
It's not bad at all.
All right, you did great on that, and we're going to go ahead and get her ready for the PDO smooth threads, and then we'll take it from there.